Planning. Planning is the important third step of nursing process. It is a purposeful activity which involves critical thinking. It is the determination of what is to be done, when is to be done, where is to be done and who will do, and also how to evaluate the results. Definition. According to Cozier, 1975, planning is a deliberative systematic phase of the nursing process that involves decision-making and problem-solving. According to Potter and Perry, 2001, planning is a category of nursing behavior in which client-centered goals are established and interventions are designed to archive the goals. According to Kropt, planning is defined as the selecting and carrying out of series of action assigned to achieve stated goals. Craven, 1996, defined planning as the development of nursing strategies designed to alleviate client problem. Purposes of planning. Give direction to client care activities. Enhance the continuity of care. Permit the delegation of specific activities. Types of planning. There are three types of planning. They are initial planning, ongoing planning, and discharge planning. Initial planning, the planning done immediately after the initial assessment, is the initial planning. Planning must be started early because of the trend towards shorter hospital stay. Ongoing planning, the ongoing planning is done by all nurses who give care to the client. They carry out daily planning by using ongoing assessment. Discharge planning. Discharge planning is the process of planning about the needs which will occur after the discharge of client. It is a crucial part of comprehensive health care and should be included in every client's nursing care plan. Phase of planning. Planning is the time where nurse determines how to provide nursing care in an organized, individualized, goal-directed way. Planning phase consists of 4 steps which are as following. Setting priorities. Determining the goals or expected outcomes. Selecting the nursing strategies. Developing nursing care plan. Setting priorities. It is a decision-making process in which nurse determines the order in which patient's problem are approached. Priorities are classified as high priority. The nursing diagnosis, if not treated, may give more harm to the client or others who have high priorities. Example. Diagnosis: ineffective airway clearance related to abdominal incisional pain as evidenced by labored breathing and cyanosis. Rationale: because of the risk of post-operative pulmonary complication, nurse will institute preventive client education early in nursing care. Intermediate priority: nursing diagnosis involves the non-emergent, non-life-threatening needs of the client. Nursing diagnosis: imbalanced nutrition less than body requirements related to chronic diarrhea for 3 weeks. Rationale: this nursing diagnosis does not affect client's immediate physiological or emotional status. Low priority: low priority nursing diagnosis are clients' needs which may not be directly related to specific illness or prognosis. Example. Diagnosis: deficit knowledge regarding smoking cessation program. Rationale: this nursing diagnosis indicates clients' long-term needs. 2. Determining goals or expected outcome. The next step is the determining goals or expected outcomes. Goals and the expected outcomes are the specific statements of client behavior that the nurse anticipate from nursing care. Goals. Goals are the statements that give direction to nursing care. Purpose of goal: to evaluate the client's progress towards derived outcome. To evaluate the effectiveness of nursing interventions. Types of goals. Depending upon the client's needs and the nature of nursing services, the goals are of 2 types. Short-term goals. Long-term goals. Short-term goal is an objective that is expected to achieve in a shorter period, usually less than week. Short-term goals are the direction for the immediate nursing care plan. E.g. nursing diagnosis: ineffective airway clearance related to the effect of sedation. Long-term goals: a long-term goal is an objective that is expected to be achieved over a longer period of time, usually over weeks or months. These can be carried out after discharge. Example: Long-term goal for a client with an ineffective airway clearance may be to remain free of upper respiratory infection for 6 months. Expected outcome. Expected outcome describe the behavior the patient is expected to achieve. It is the specific step-by-step objective that leads to the attainment of the goal and the resolution of the etiology for the nursing diagnosis. Outcome is a measurable change of the client's status in response to the nursing care. For example, if the nursing diagnosis is potential impaired skin integrity related to irritating stomal discharge, the expected outcome is the skin around stoma free of redness, excoriation through hospitalization. Nursing goal. Client outcomes. Describe what the nurse expects to do for accomplishing client goal, e.g. to teach the client how to do deep breathing exercise. Gives direction/pathway to select nursing activities. Usually developmentally may or may not be documented. May include nurse's own personal objective for learning. Describe what the client is expected to attain as a result of nursing goal. E.g., client will demonstrate deep breathing exercise. Gives direction to client activities. Clearly documented on nursing care plan. Includes only client-oriented objectives. Rules for formulating the expected outcomes. The following rules serve or guideline for writing the understandable outcomes. Outcome should be related to the problem statement. Outcome should reflect the first half of the diagnostic statement. Outcome should be client-centered. Outcome should be clear and concise. Outcome should be observable and measurable. Outcome should be time-limited. Outcome should be realistic. Outcome should be determined by the client and nurse together. 3. Selecting the nursing strategies/interventions. Nursing strategies/interventions are the specific approaches designed to assist the client to achieve outcomes. They are based on the etiology and the nursing diagnosis statement, the information obtained during the assessment interview and the nurse's interaction with client and family. The nursing interventions defines how the nurse will assist the client to achieve the proposed outcomes. A. Components of nursing strategies. A set of nursing interventions should be written to accomplish each outcome. To be effective, the nursing interventions must be written as clearly and concisely as possible. Nursing intervention should specify who will complete the intervention of other than the nurse implementing the plan of care, e.g. client, family, and consultant. Example, consult the dietitian for getting diet chart which is suitable for client. Nursing intervention should enlist what specific activities must be implemented to accomplish the identified outcomes. Example, teach client to utilize abdominal breathing techniques when experiencing stress. Nursing intervention should define where, when, and how often the activities will take place. For example, give hydrotherapy for 20 minutes at one time. Describe how the activity should be implemented. Example, irrigate the wound with normal saline solution. B. Types of nursing interventions. The nursing interventions can be categorized as nurse-initiated/independent interventions. These are the activities that may be performed by nurse without a direct physician's order. Such type of activities she can perform independently depends upon the nursing diagnosis by virtue of their education and experience. For example, interventions for increasing a client's knowledge about adequate nutrition or activity of daily living related to hygiene are the independent nurse-initiated activities. Physician-initiated interventions, these are based on the physician's response to a medical diagnosis and the nurse completes the physician's written order. For example, administering medication. Preparing client for diagnosis test are the physician-initiated interventions. Each physician-initiated intervention requires specific nursing responsibility and technical nursing knowledge. Collaborative intervention, it describes the activities that the nurse carries out in cooperation with other health team members. It may involve collaboration with social worker, occupational therapist, dietitians, technicians and physician. C. Selection of intervention. When selecting interventions for a client, the nurse, using clinical decision-making skills, deliberates about 6 factors. They are Characteristics of the nursing diagnosis: interventions must be directed towards altering the etiological factors or signs and symptoms associated with the diagnostic level. Interventions may be directed towards altering or eliminating risk factors, which are associated risk for nursing diagnosis. Expected outcomes: outcomes are stated in measurable terms and used to evaluate the effectiveness of the interventions. Research base: review clinical nursing research related to diagnostic label and client problem. Review articles that describe the utilization of research findings in similar clinical situations and settings. Feasibility: interaction of nursing interventions with treatment being provided by other health professionals. Feasibility includes cost: is intervention both clinically effective and cost efficient? Time: are time and personnel resources well managed? Acceptability to the client: treatment plan must be suitable with client's goals and healthcare values. Mutually decided nursing goals: client must have required self-care abilities or have a person who can assist with healthcare. For developing nursing care plan. Purposes of care plans. The nursing care plan is a written guidance for client care. Nursing care plan identifies and coordinate resources used to deliver nursing care. It enhances the continuity of nursing care between nurses in the hospital and community. Nursing care plan helps in evaluation of care and in determining whether the goals of care have been achieved. Nursing care plan is a blueprint for nursing action. It is a well-organized nursing care plan in various settings. The guidelines for making the nursing care plan varies from one healthcare setting to another. In hospital setting, a care plan may consist of columns for assessment, goals, interventions, and expected outcomes. In community health setting, the care plan in community health setting includes the needs, goals, plan, and expected outcomes. Discharge planning: the nursing care plan developed for client returning home is based solely on long-term health needs. In discharge planning, the client, family, and significant others are more involved in planning because they are responsible for giving care to the client at home. How to write nursing care plan. Writing the nursing care plan is an initial step in planning. After assessing and diagnosing the patient, nurse assigns a priority to each nursing diagnosis. The nursing diagnosis with the highest priority the beginning point for the nursing care plan. The student's nursing care plan consists of 5 columns.
SN. Assessment. Diagnosis. Goal expected outcome. Nursing care. Rationale. Evaluation. Planning intervention. Implementation.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.